affordable health insurance to every single Kentuckian for the first time in history. Specifically, we're here to talk about the implementation of the health benefits exchange. Open enrollment for that insurance begins October 1. So it's important that we get the word out to people so that they know what to expect, what the plans are, and what they look like, and what the cost will be. Let's look first at the existing reality that we face in Kentucky. We have approximately 640,000 uninsured Kentuckians. They have no health insurance. That's almost 15% of the population of Kentucky. What does that mean for these families? What it means is that it jeopardizes their health and their financial security. They roll the dice every day and just hope and pray that they don't get sick. They choose between food and medicine many times. They ignore checkups that would catch serious conditions before they would get that advanced. They put off doctor's appointments, hoping a condition turns out to be nothing. And they live knowing that bankruptcy is just one bad diagnosis away. Now, for children, the ramifications are worse. They're more likely to go long periods of time without seeing a doctor, which means they don't get regular checkups for immunizations, preventive care, and vision and hearing tests. So if they have diabetes, arthritis, asthma, other chronic conditions, it's more likely to go untreated. Now, some unempathetic people like to categorize the uninsured as freeloaders. That is so far from the truth as to be ridiculous. Most of these people are working, but they don't have insurance because it's either not available to them, or they can't afford it, or their employer doesn't cover their families. Folks, these are our families, they're our friends, they're our neighbors. Let me assure you, you would be surprised at how many of these 640,000 Kentuckians you know. You go to church with them. Your kids go to the same school. You have them over for backyard barbecues. You sit in the bleachers with them at baseball and football and soccer games to cheer the kids along. Now, for the state, it has a similar negative impact, but a much larger scaled impact. Jacking up healthcare costs, decreasing worker productivity, hurting our quality of life, lowering school attendance, and destroying the collective health of our people. In fact, this is one of the greatest hindrances to Kentucky's improving its future. As you know, we rank the worst or close to the worst in an array of health-related categories, from preventable hospitalizations to cancer deaths to premature deaths to cardiovascular and cardiac heart disease. In fact, I could give you a long list of all of those categories. And the frustrating thing is, our rankings haven't changed much since they began keeping rankings of the states on these things. Year in, year out, decade in, decade out, we have continued to rank among the worst states in terms of collective health status. We now have a historic opportunity to change all of that, and that's exactly what we're going to do. With the Affordable Care Act proposed by President Obama and passed by the Congress, we can transform this state. Now, how are we going to do that? Well, some 308,000 of Kentucky's uninsured, mostly the working poor, will be covered when we increase the Medicaid eligibility guidelines to 138% of the federal poverty level. I announced that decision on May 9, and it will take effect January 1. The other 332,000 uninsured Kentuckians will be able to access affordable coverage through the Health Benefits Exchange, the online insurance marketplace. If you remember, the states had the option to either create an exchange of their own or let the federal government do it for them. We chose to do it ourselves. And let me tell you, that was a decision that had widespread and passionate support from people in all areas of the healthcare industry. Now, open enrollment for the exchange, which we're calling Kynect, Kentucky's Healthcare Connection, begins October 1 and runs through March 31, 2014. If you sign up by December 15, it takes effect January 1. Last month, we opened a call center run by Xerox in Lexington to handle questions about Kynect and to help citizens navigate the application process. The center began with 60 professional customer care representatives, and by October, we will have 100 such representatives at the call center. We're also training some 5,400 people at sister agencies and in local communities all across the Commonwealth to help enrollees. People can enroll over the phone, they can enroll online, or they can enroll in person. Today, we want to give you some details about the plans and talk about the process. First, who's eligible? Let's talk about who's eligible. It's helpful to look at this first chart that you see here on my right that explains Kentucky's health insurance status. The slivers of the pie break down like this. You see the red down here at the bottom. Employers cover 48% of our population. Going up around to the left, public employees make up 1% of that population. Medicare covers 14% of our population. Existing Medicaid covers 18% of that population. The uninsured make up about 15%. That's the 640,000 currently uninsured Kentuckians. And individually insured, that's about 4% of the population. We're going to have, now, today, we're going to talk mostly about this 15%, the part in the green, the uninsured population. These people are going to qualify for coverage either through Medicaid expansion or via Kynect. Some of the people in this 4% category that you see labeled individual, the individual market people should also check on Kynect, as they may also qualify for subsidized coverage. And of course, a very few of the people in the employer category might also find a better deal through the exchange. Now, what plans will be offered? 5 health insurance companies will be providing insurance through Kynect, although not every company will be offering insurance in every region of the state. In fact, we've divided the state into 8 regions, the Medicaid regions, for purposes of signing contracts. Kentucky's fortunate. We're going to have competition in every region, with at least 2 companies offering coverage. These companies' plans and rates, which they submitted on a formal basis, have been reviewed and approved by the Kentucky Department of Insurance. The companies are Humana, Anthem, United Healthcare, Bluegrass Family Health, and the Kentucky Health Cooperative. 4 companies have indicated a desire to offer dental coverage: Guardian Life Insurance Company of America, Anthem, the Dental Concern, and Best Life and Health. These plans are still under review. Now, there are 3 defining characteristics of this health coverage. It's guaranteed, it's high quality, and it's affordable. That first point is transformational. Guaranteed issue. This is a historic event in the Commonwealth. No longer can insurance companies deny you coverage because you're sick or you have a pre-existing condition. And by the same token, no longer can they drop you just because you get sick. The second characteristic is that it's quality coverage. Under the Affordable Care Act, states must certify that every health insurance offers coverage for a uniform list of medical needs, called essential health benefits. In Kentucky, these benefits are more robust than previously required. Every health insurance plan in Kentucky now must include coverage for the following: ambulatory patient services. That's medical care you receive without being admitted to a hospital, such as in a clinic or a doctor's office. Emergency services, hospitalization, maternity and newborn care, mental health care, including substance abuse treatment, prescription drugs, rehabilitative services and devices, laboratory services, preventive and wellness services, and chronic disease management, things like routine physicals, screenings, and vaccines, and pediatric services, including oral and visual care. We're particularly thrilled with the mental health care requirement because this is one area where Kentucky has long been lacking, especially in the area of substance abuse treatment. The Affordable Care Act also bans insurance companies from imposing lifetime dollar limits on health benefits. What does that mean? That means that cancer patients and others with chronic diseases won't have to worry about going without treatment. Now, the third characteristic of this insurance: it's affordable. Now, I know that cost is on everybody's mind. That's what everybody's been talking about as we lead up to the launch of our health benefits exchange. And it's just exactly what this kynect website and the staff will help families determine. There will be 4 factors that determine your upfront rates: your age, the number of people on your policy, whether you use tobacco, and the region in which you live. Notice that I did not say gender or whether you have a pre-existing condition. Now, this rate that we just mentioned is sort of like a sticker price. Don't get stuck up on it. It's like when you're going to buy a car. That sticker price isn't the final price. In this case, in Kentucky, under the Health Benefits Exchange, the vast majority of people who qualify for this coverage, some 85% of the people also qualify for subsidies or discounts. Big ones. What that means in terms of numbers, folks, is that of 332,000 uninsured Kentuckians that are eligible to use this exchange and get one of these policies, all but 50,000 of them are going to qualify for some type of subsidy or discount. These subsidies depend primarily on your income and on your family size. The income limits for qualifying for subsidies are very high. An individual earning up to $45,960 a year will qualify for a discount. A family of 4 earning up to $94,200 a year will also receive a subsidy. Now, once you've determined that initial rate, individuals must decide among several health plan options. There are 4 general plans that exist for each company. We call them metal plans because the levels are called bronze, silver, gold, and platinum plans. Actually, there's a 5th plan, a catastrophic care-only option that's available to only a small segment of people, those that are under the age of 30, for example. It has a very high deductible and no subsidy. But let's talk about these 4 main plans. All 4 of them offer the same coverage. So you're going to get the same coverage, all of those things that we just listed for you in every one of those plans. They just have different monthly premiums and out-of-pocket cost. Now, if you pick the plan with the lowest monthly premium cost, then you'll have a higher out-of-pocket cost, such as deductibles, co-pays, and co-insurance. Likewise, a comparatively higher monthly premium usually means lower out-of-pocket cost. That's typical for health insurance plans all over the country right now. Now, as you can see, it's possible to determine an average cost of health insurance through kynect because trying to make such a determination is meaningless. There are too many factors. to create an average that would be useful. So we can't give you a definitive set of numbers or even a chart because there are too many different variables for each individual family. The bottom line is that families must do some research to determine their personalized rates and subsidies, compare the plans, and determine which is the best plan for their needs. The kynect site and the call center staff, that's what they're there for. They will help them run various scenarios with different plans, shop around, and compare prices. Individuals and families will be able to begin doing that on October 1. I also caution you against trying to compare cost of insurance through kynect with that offered on the individual market in previous years. This is an apples to orange comparison. As a matter of fact, it's more like apples to asparagus because it's not even in the same food group. The new plans offered under the Affordable Care Act are unlike any health insurance plan sold in the past. The coverages are so much different. The difficulty of cost comparisons aside, I do want to give you some examples, some scenarios on kynect so you can appreciate how low some of these costs are going to be. Let's look at these charts, and we're going to go through several of them, and I think you also have these in your packet. Here's the first example. We have a 22-year-old woman. She's a non-smoker. She earns $20,000 a year. Now, she could pay as little as $51 per month in premiums. Let's look at the next. Here's a 24-year-old man. He has a pre-existing condition. He's a non-smoker. He earns $24,000 a year. When you plug all of his information in, he could be paying as little as $98 per month for all of that coverage that we've already listed for you. Here's a 50-year-old man. He's a smoker. He earns $30,000 a year. He could be paying as little as $160 per month for his coverage. Here we have a 32-year-old single woman with 2 children. She's a non-smoker. She earns $40,000 a year. She could be paying as little as $133 per month. Here we've got self-employed farmers. They're in their mid-50s. They're non-smokers. We've got a lot of these folks in Kentucky. They earn $34,000 a year. They could be paying as little as $47 per month in premiums. Here's a family of 4 non-smokers. They earn $70,000 a year. They could be paying as little as $403 per month to cover the entire family. We also have in your packets a breakdown of these kinds of examples depending upon what plan somebody chooses. These, I believe, are based on the bronze plan. Is that right? These examples. But there are examples in your packet of what these people would pay if they picked a silver plan or a gold plan or a platinum plan. So you can readily tell that a rate means very little here. What means a lot are the individual factors that each person brings to the table, and then what choices they make in terms of what plans that they want to have. The bottom line is, go look. Doesn't cost you a dime to go look. Don't be afraid to go look, because what you're going to find, most people are going to be very positively excited about. They've got to check out kynect to determine their cost. Now, the one point that we want to make very clear to everybody is that in order to qualify for these subsidies that are out there, you must go through kynect to get your plan, to get your coverage. So don't think you can just run out on the individual market and do that. Go look on kynect. Call them up. We've got the numbers, the website right here. Doesn't cost you a dime to check it out. And as I say, when you check it out, when you plug in your information, the vast majority of people, I think, are going to be very excited by what they find. Now, there's also been a lot of talk about what this means to small business. So let's talk about that for a minute. If you have fewer than 50 employees, you're not required to provide coverage, and there's no penalty if you don't. So that's the first thing that all small businesses need to know. However, your employees should look at Kynect to see if they qualify for coverage. And if you have fewer than 25 employees, it behooves you to go look yourself, small business. Why? Because your business might qualify for tax credits. So if you have fewer than 25 employees, small Kentucky business, go look on Kynect and see what is offered that you could provide your employees and get tax credits for it. Now, we've been working diligently for months to get this word out via commercials on television, radio spots, print ads, a mobile tour, a booth at the state fair that handle thousands of questions. And today's briefing obviously is an ongoing effort in that publicity strategy. We need to get the word out. It's important that everybody who is eligible for this subsidized insurance check it out. And when they check it out, they're going to sign up. It's doubly important for Kentuckians who now get insurance through Kentucky Access, because Kentucky Access is going away. You know, Kentucky Access is the state-authorized health plan for Kentuckians who find it difficult to obtain insurance in the individual market. So please, if you're in Kentucky Access, make sure you check this out. I'm proud that Kentucky has been among the leaders in implementing the Affordable Care Act. Kentucky is the first state-based exchange to complete the readiness review with the Federal Department of Health and Human Services, and that focused on technical aspects. It is possible, and we're pushing very hard to be the first state-based exchange certified by HHS. Kentucky is the only southern state both operating a state exchange and expanding Medicaid. Folks, this is a historic opportunity. For the first time in history, we're going to be able to provide affordable health insurance for every single Kentuckian in the Commonwealth. Our collective health is horrible. It's been horrible for a long time, and no critic of the Affordable Care Act has stepped up with any feasible, large-scale plan to do something about it. Like I said the other day, it's amazing how people who are pouring time, money, and energy into overturning or defunding the Affordable Care Act sure haven't put that same kind of energy into trying to improve the health of our citizens. And they've had decades to work on this problem. During this time, things have just gotten worse and not better. It's a well-publicized fact that 2/3 of all bankruptcies were caused by a serious health condition. And yet, those that keep trying to unravel the Affordable Care Act, all they can come up with is not that. There anything positive anybody's offering, it's just, well, we don't need to do that. Well, my friends, the time for partisan debate is long past. The Affordable Care Act is the law of the land. It was proposed by the President, it was passed by Congress, and it was upheld by the United States Supreme Court. The more people understand it, the more they're going to approve of it. Folks, this very same approach is working in the state of Massachusetts. And then Governor Romney, many years ago, implemented it in Massachusetts. It has a mandate, and people are participating. Companies are participating. It works there. It's going to work in the United States. It's going to work right here in Kentucky. The only issue now is how we can best implement it to help all the people of the Commonwealth. Okay. Now we'll take your questions.
Governor, of the rates presented here today, how close are those to what was requested originally from the insurance companies?
What was requested from the insurance companies?
When they first put in the bid and they made the case for the rates, how
Well, the rate-making process was an ongoing process, and the companies stepped up, I think, and initially filed draft rates, and then the insurance department has been working with them back and forth, and I think it's safe to say, DJ, that they've changed considerably over a period of time.
We have had amendments to the filings, and of course, those were rates with the subsidy applied that we showed on the examples.
Right. The rates, obviously, that have been now approved for the insurance companies are those initial rates that I talked to you about. They're not what you see the results being, because you apply the subsidies to those rates, and then you get what you're really going to have to pay. So if you want to inform the public of what this is going to cost them, then we need to inform the public of what it's going to cost them after they get their subsidies.
I guess what I'm asking is, did the companies get what they asked for?
Give a what?
Did they get what they asked for on these rates?
Sometimes yes, sometimes no.
Sometimes yes, sometimes no. You know, what the rate process is that the actuaries at the insurance department then start looking at those proposed rates, and then they go back to the companies and say, wait a minute, this doesn't make sense. And it's a real give and take process before they finalize those rates. Is that
Yes, sir.
correct?
And that's what we do with any, and we have done that for years at the Kentucky Department. Any rate that is filed with us has an actuarial review.
Governor, you've laid out the arguments for it. Obviously, some critics are concerned about what rates might go up. Is there any study or an impact statement on those people whose health insurance rates will be more as a result of this?
Obviously, this is a new program, and I know that people are concerned because of the unknown factors, just like they're concerned about any new program, because it's very difficult to predict what's going to happen down the road. What I foresee, quite honestly, is rates moving in a favorable direction after we begin getting experience here. I think our experience has been that companies, because they're concerned about the unknown also, you know, they're having to make sure that their rates are going to be high enough to protect themselves, and they're not sure exactly what the experience is going to be. And so I think, if anything, our experience will be that once this program starts, and in the next year or two, you're going to see a leveling out of a lot of the rates, because they will know then. They will have the experience necessary to factor in. Now, keep one thing in mind, and I'll make sure I get this terminology accurate. By federal law, these companies have to spend at least 80%
That's correct.
of their premium,
Yes, sir.
80% of their premium on claims.
That
On
is
claims
on
cost.
actual delivery of health care, and that law has been in effect now for at least a year. And last year, that there was a rebate totaling about $5.5 million that went back to Kentucky policyholders. So at the end of the year, there is a mechanism through their financial reporting that they report to the Department of Insurance how much was collected through premiums and how much has been spent on the healthcare delivery. If it does not meet that ratio that the governor mentioned, then they are ordered to return to the policyholders the extra rates, charges they might have collected.
So that's an additional safety valve in this whole rate setting process. Obviously, they're being very cautious now, and I understand that. They're business people, and they're dealing with an unknown situation here. So I suspect that the initial rates that they have set, while they fall within the actuarial range that is acceptable, that they may well be a little higher than what they need to be. But at the end of the year, when we get all their information in, if they haven't met that 80% threshold, if they haven't spent at least 80% of their premium on actual health care delivery, the policyholders for that company get a rebate. And and then that will help them, I think, also determine
Yes,
what
sir.
the rate should be
Pricing for the next year.
for the next year. And I think that you may well see a downward adjustment as they gain some experience with this Affordable Care Act.
Governor, from the state's perspective, how much is the state going to charge the insurance companies in fees to operate this health exchange over the long term?
Well, that will be a work in progress also, because right now the federal government is funding the establishment of the exchange. And as we approach that time to where we're going to have to start picking up some of the costs, you are correct. We're going to assess that cost against the insurance companies. I think it's fair to say that we will also have some experience then in how to run the exchange so that we will know better exactly what our costs will be, and then we can make that determination.
And is the state gonna have any role in enforcing the mandate to have insurance?
It's federal.
That
Agent.
is real operate through the federal government.
Yeah, the federal government's responsible for that.
That's the federal government's responsibility.
Because the federal government has given Kentucky and other states, I guess, seed money, for lack of better words, to help get this going. And that of course expires after a certain amount of time. Are these examples you're giving us here based upon that money coming in, and when that money goes away, are those rates then adjusted?
No, the seed monies and grants that we have received were for planning and getting everything set up, and then for running the exchange for a period of time. That seed money has no effect on the premiums that'll be charged, and the subsidies that the federal government provides. Those subsidies don't come from the state. They come
That's
from the
correct.
federal government.
For how long are these premiums expected to hold steady?
The premiums,
Rates that we're seeing?
well, they file. How often do they file? rates?
They'll be filed each year.
Once a year.
They file each year.
There's been some, back critics, there's been some information circulated that people are going to be forced into the Medicaid expansion system. No one has to do this.
No.
It might be unwise not to, but they're not forced to do anything.
A person obviously would be wise to go on the exchange and to go with Connect, because Connect will be able to determine, after they give them the information, whether they qualify for Medicaid, for the new expanded Medicaid. If they are, in my mind, they'll be crazy not to take it, because it's basically free health care. But if they don't want to take it, okay. But I would hope for themselves and for their children and their families, they would be wise enough to take it.
Governor, do you have any comment on, obviously, the Obama administration has delayed the employer mandate being in place. What concerns do you have about part-time employees' hours being cut to when it is finally implemented, and how the overall effect?
You know, when you implement something new like this, there are going to be some rules and limits and different things, regardless of what they may be. And you're always going to find some example of someone who may say, oh, well, I'm not going to do that then because I'd have to pay more money. And, you know, that may happen in a few instances when we first start out. But I would predict to you that after we get this up and running and that people see it works, see what a healthier population we're going to have, that you're going to have very few people gaming the system. They're going to move ahead, and from a business point of view, they're going to understand that if I've got a healthier workforce, I'm going to have a more productive workforce, and I'm going to be able to make a lot more money because I don't have the absenteeism that I've had before. I'm not going to have the sickness that I've had before, and we're just going to have a lot more productive workforce and make a lot more money.
Politically, you had lunch with Senator Thayer, and I understand he expressed his opposition to the expansion to you. What kind of a fight do you expect in the 2014 General Assembly from the Senate Republicans about going forward with the exchange and Medicaid expansion?
I know that there are some critics, and I don't criticize the critics to the most of them to the extent of questioning their motives. You know, I understand that some people have some doubts about this. I would first direct them to look at the numbers. You know, we did an economic study of this before we went in this direction. Obviously, to me personally, it's the right thing to do for our people. But I didn't take us down this road until I could determine that Kentucky could afford to go in this direction. And the University of Louisville's Urban Institute, PricewaterhouseCoopers, certainly not people under my thumb. I mean, they did an independent analysis of this and concluded overwhelmingly that we'd be crazy not to do this. I mean, with the positive economic benefits we're going to have, it's going to be not only good for our individual people, it's going to be good for our state long term economically. I'm proud to say that we made the decision to expand Medicaid and to create the exchange. Both of those decisions have been held up in court, and we're charging ahead. I mean, we're going to make this thing work, and you're going to see Kentucky the better for it.
But are you gearing up for a fight to defend it in the 2014 session?
Well, I certainly know that a vast majority of our House of Representatives supports what I'm doing, so there may be some discussion of it, but I don't see anything ultimately happening.
Anything else?
Okay, thank you all very much.